Hello.
Hello.
How- Hi, Yunping.
Hello.
So, Yunping, I want to thank you for talking to me and for sharing your experience and your story. And I know that you know that we're recording this and that we're going to share this with other Chinese students because I am so very proud of you that I want all of them to know your story.
Mm-hmm.
Just for them, I want to introduce myself. My name is Ita, and I'm Executive Director of Global Strategy and International Programs at the Massachusetts College of Pharmacy and Health Sciences, or MCPHS. And you are Yunping Zhuo.
Mm-hmm.
You are a sixth year student of our Doctorate of Pharmacy program. And so you're going to graduate in May. Congratulations.
Thank you.
May, now, could you tell us where you come from in China, and just a
Mm-hmm.
little bit about your background before MCPHS, and how did you find out about MCPHS?
Mm-hmm. So I'm from Shanghai, China, and I came to America when I was 18 and came to MCPHS. So how I found about MCPHS is my grandmother. She saw the newspaper and saw an article about this school, and they are looking for new students from China. So I went there, and they interviewed with Renee, and he got me in.
Okay, great. And I already promised you that I'm going to tell Renee because he's going to be very proud of you too.
Mm-hmm.
Um, and so you've been at MCPHS for 6 years in the program.
Mm-hmm.
How did you, do you want to talk to us a little bit about your experience during the program? What is the program like?
Program, the first 2 years is pre-professional. You learn some general classes like chemistry, biology, and the 4 years is the professional years. Starting from the third year, you are going to do rotations, and the sixth year, the whole year is going to be rotations in different hospitals or retail pharmacies, or if you want, you can choose some electives. And we also have international rotations in this school. And the school, starting from the third year, you are going to have experience as working in a real pharmacy, and the you are going to do you are dealing with real patients, and you are going to practice learning drug information, learning how to do interventions with doctors, learning how to do counselings, things like that. You are going to prepare yourself, and when you are graduating, you are ready to become a pharmacist.
Okay, and for the students who maybe don't know yet, could you tell us what rotation is?
Rotation is it's like the school help you. You're going to be in a lottery, and you're going to pick what's your favorite 10 sites to do your rotations. It's like similar to working an internship, similar to an internship in a pharmacy or in a hospital. And you in a lottery, and you pick 10 sites, and the school is going to decide, mm, like lottery decide which site you go to. And uh, you can pick based on which area you're interested in. For example, some people may be interested in oncology. They can go to a hospital that's more focused on the oncology, but it's based on some is based on the luck. If you pick it, you don't really get to. It's not 100% you can be getting into the site, but you can choose based on your interest.
And so when you do rotations or internships, like you call them,
Mhm.
you do them in many different sites?
Yes, the one it's like retail, it's community rotation, institutional rotation, internal medicine rotation, and ambulatory care. Retail rotation is in community pharmacies or outpatient pharmacies in the hospital, and it's a lot of dispensing in the hospital or in the pharmacy. Institutional, you learn about the protocols, and you learn about how to distribute drugs to each floor in the hospital. And long-term care is also belong to the institutional. In internal medicine, you are working similarly as a clinical pharmacist. Your preceptor is going to be a clinical pharmacist, and you need to do interventions. You need to do a lot of patient cases, and also journal clubs. You need to see real patients. You need to go rounding. If for some new students, rounding is you go to the floor and the doctor is going to kind of talk about who is our patient on this floor right now and what's the problem and how we are going to, what's our plan for this patient. And you are going to, if there's anything wrong, you need to do the intervention. And if the doctor asks you any question about the medication, you need to answer it correctly. And the last one is ambulatory care. It's like outpatient, and you are going to see the patients and you are going to ask them questions like what medication do you take and how are you doing, what's your blood pressure like, how is everything, and you are going to write a progress notes and also do interventions with your preceptor, and your preceptor is going to ask you what's your plan for your patient. And these include, my ambulatory is with diabetes clinic, and some others include asthma clinic, smoking cessation clinic, things like that.
Well, that sounds so interesting. And so a lot of students also ask me about clinical pharmacy. So
Mm-hmm.
some of these you described are also clinical pharmacy.
Mm-hmm.
And so now you're coming up to the end of the program, the end of the 6 years. So pretty soon we are going to call you Dr. Zhuo.
Yeah.
And during these 6 years, you also sought to get as much experience as possible.
Mm-hmm.
And you did some internships. And now you're going to graduate and you already have a job. You've been hired in a very, very prestigious hospital. So I'm going to let you tell the story. Can you tell us first how you found this hospital and
Mm-hmm.
how did you get the job?
Mm-hmm. So I found this hospital 5 years ago. MCPHS is doing an open house, and I'm representing Chinese Students and Scholar Association. And so a faculty member came to me and talked with me, and he asked me if you know about Jiahui International Hospital. I said, I don't. And he said, they are looking for students graduating from NCPHS and go back to China to work as a pharmacist. I think that's a great opportunity for me, especially I'm looking for a summer internship at that time. So I just Googled this hospital and found it very interesting. It's very, the way they are managed is similar to American hospitals. So I send my resume and ask if I can work as an intern. And they are also very excited because they never had an intern before. And they say, yeah, you can come as an intern. So I interview with them and they accept me as an intern in summer. And right now, that's about 2 years ago, I started my internship in Jiahui Hospital. And right now, I think I like this hospital. I like the people there. And it's patient-centered care, which I really want. That's something I really want to do. So I decided to apply for this job, and they send my resume again, and they say, yeah, you can come back. You don't need to be interviewed again. You can just come back. And they, so I just start my job there. Mhm.
Impressed them so well
Mhm.
that they accepted you for a job. That's
Mhm.
wonderful.
Mhm.
You talked about patient-centered care.
Mhm.
I think students who are considering healthcare, studying healthcare in the United States, I think it's important for them to know what that means, particularly
Mhm.
students coming from China. I know you and
Mhm.
I talked about the differences in healthcare in China and in the United States. Can you tell us a little bit about those differences?
One big difference is I think the time you spend on each patient. In China, we know there's a big population, so the doctor needs to be efficient and accurate at the same time. But so they may lack some preventive care, more focus on curative care. And in China, it's very efficient. You may see a patient just, you don't need to have appointment. You just go to the hospital and see a patient, see a doctor, and the doctor give you some medication. Here is more like you do by appointment, and you tell them your problem, and they will make a problem list focused on each patient and work out each problem, not only one problem at a time.
So when you say patient-centered care, that's spending more time on the experience of the patient.
Yes.
Okay. And would you say that Jiahui Hospital is more similar to Chinese healthcare or American style healthcare?
I would say they have both. They are like you spend a lot of time on one patient, but at the same time, they are adapting some Chinese, like the efficiency in China as well.
So you're the perfect employee because you know American style healthcare that they are using, but you know Chinese culture and language, and so you can serve Chinese patients perfectly for them. So Jiahui International Hospital is a private hospital, is that right?
Yes.
Do you also see a difference between private healthcare industry and public healthcare industry?
One big difference I see in the pharmacy is counseling service. From my experience, I don't see pharmacists doing counseling a lot. More of the time, it's the doctors. They are doing counseling, and they tell us how to use the medication instead of pharmacists do it. But in Jiahui, is pharmacists, they are doing counseling.
Oh, that's very interesting. So I think that you're going to be admired by many Chinese students, and can you help them out and maybe give them some advice?
The first advice is, since we are international student, and compared to American student, they can have internship, and experience is very important in this program. And we only have 1 year OPT, and some of you may not want to use up the OPT before graduation. So I recommend you, when you are visiting home during summer, go find some internship in China. It doesn't have to be like Jiahui Hospital. There are other public hospitals and other international hospitals as well. And if you are interested in industries, there are a lot of pharmaceutical companies as well. So I really recommend you find an internship during summer in China so you have some experience. It's not only good for your future career, it's very helpful preparing for your rotations. When you are in 6 years, you will find some of the knowledge you already learned in China during the internship. And another thing is about the licensure. So there are two types of licensures in China as a pharmacist. One is for the retail pharmacies, and the other is for the hospital pharmacies. So can I speak Chinese, like the name of the license? The one for retail pharmacy is called 执业药师. The one for the hospital is like 初级药剂师, 中级药剂师. It's like entry level pharmacist, mid level pharmacist for hospitals. And the retail pharmacy, the 执业药师, is held in July, I think. they are both. 职业药师, I think you can take it several times a year, so you can take it right after your graduation, but it's only for you to work in a retail pharmacy. And I think in Guangzhou, they may accept this license, the 职业药师 one in hospital as well, but other place, I don't think you can interchange with them. And the hospital license is only once a year, and you need to apply after you graduate. You cannot do it before you graduate. So the time to start, I think it's in January after you graduate, and you prepare for the exam, and you get the result in May or June. That's when you can get the license the earliest. And so before that, you are only a trainee. You are not a pharmacist.
Okay. Thank you. That was very helpful. And I do want to come back to how you said that experience is very important.
Mm-hmm.
Would you also agree that networking is very
Yes. Mm-hmm.
Tell us a little bit about that.
Yeah, networking, like the open house is how I get my job. And also we don't like before I graduate, I don't think a lot of Chinese students graduate from our school and especially go back to China. And I also like benefit a lot from people graduating ahead of me. They teach me a lot. Like they teach me what kind of things I need to notice in looking for a job. And the most important advice I always get from other Chinese students is find a job you like. And also like you can get some different opportunities, learn about, see if you're interested in industries. I think in industry areas, networking is extremely important. And what else?
Networking in Chinese.
Mm?
How do you say networking in Chinese?
社交, things like that. I'm not so sure. I usually just say networking.
Oh, okay.
Yeah.
Well, I think we're very lucky that you took the time to explain.
Mm-hmm.
I really want to thank you,
Mm-hmm.
to congratulate you again for
Thank you.
also have an awesome GPA. So you've done really well these past 6 years. Dr. Zhuo, we wish you much success. We'll stay in touch, and I hope you'll take time in the future to help out future students too,
Mm-hmm. Mm-hmm.
as successful as you. So congratulations. And
Thank you.
okay, 谢谢. Thank you so much.
No problem.